probably knows someone who had COVID-19 and then experienced long-term, sometimes quite serious symptoms, often referred to as long COVID. Now, NARCOMS data was used to study how long COVID was impacting people with MS. So first, can you tell us how long COVID presents? And then please tell us what you learned in this study.
Long COVID is a syndrome, and in fact, post-acute sequela, or PASC, P-A-S-C is the acronym, is a constellation of symptoms that can be seen long after an infection seems to have cleared someone's body. So we've been familiar with this post-acute sequela, or PASC, of a variety of infections. So this was understood and recognized long before COVID developed, but it's most notable and most recognized around COVID. And the term, as you relate it, long COVID, has become sort of a commonly used term. And these symptoms are quite varied. They can include fatigue and cognitive difficulties, loss of smell, loss of taste, also other symptoms that sound similar to those of MS. And what we found is that amongst those who had COVID in the recent months, about 10% reported symptoms of long COVID, or these persistent symptoms after the infection. Now, what surprised us is that although it was 10% of COVID infection participants, it was almost 30% of those with non-COVID infections. So what we found is those who had infections other than COVID were even more likely to have these chronic long-term symptoms. Now, to make it a little bit more complicated, is that when we looked at the overlap of these symptoms with MS symptoms, they're very, very similar. Of course, concentration problems, fatigue, and what we found is new long COVID, or the incidence of patients who had newly developed symptoms of long COVID that weren't there before COVID, was actually very, very rare. It was very uncommon. Now, part of it is because a lot of those symptoms were there already. And so part of the definition of long COVID is that these are new symptoms. And so what that highlights is that long COVID is really tricky in people with MS because of the overlap of long COVID symptoms and just symptoms of MS.